Burnout is real, especially in the healthcare field. One of the things that I highlight with every NP I work with, I always ask them what's their ultimate goal. We're used to the 9 to 5, and while there's nothing wrong with that, burnout also exists. You can make all the money in the world, but...
Hey everyone, welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey, co-founder of SensorMed. I'm super excited. We have another practitioner, someone who's out there doing the work. Ebony Thyme, how are you today?
I'm doing fine. How are you?
I'm doing wonderful. Ebony Thyme is a highly experienced family medicine nurse practitioner with a strong background in critical care, med-surg, and family medicine. With over 10 years of nursing experience, Ebony is dedicated to providing high-quality healthcare to her patients. Beyond her medical expertise, Ebony is also a passionate traveler who explored over 30 countries solo. Combining her love for travel with her profession, she embarked on a unique journey as a traveling nurse practitioner, also known as a Locum Tenens provider. This allowed her to immerse herself in different healthcare environments while experiencing diverse cultures around the world. Ebony has been featured in prestigious publications such as Forbes, Business Insider, Good Morning America, Yahoo, The Washington Post, Travel Noir, and Essence for her innovative approach in navigating and integrating a lifestyle that combines travel and medicine. She highlights this through her social media platforms for nurse practitioners seeking the locum route. Ebony provides practical guides and strategies to navigate the complexities of the healthcare profession and build a thriving independent practice. With Ebony's expertise, healthcare professionals can unlock the freedom to choose where and when they work while still delivering exceptional care to their patients. Ebony is dedicated to transforming the lives of healthcare professionals and empowering them to achieve rewarding work-life balance. I love that. That is amazing what you do. It's a lot that's going on. Obviously, Locum Tenens has been around for a while and helping providers kind of navigate that challenges. I think I saw in a recent journal of advanced nursing study that reported that, Locum Tenens providers play a critical role in improving access to care, especially in underserved areas. What insights have you gained from your experience that could help others succeed in this space?
So it is true. We come in as locums to fill in the roles for providers, right? Especially what I've noticed more, and I want to say since COVID, even though locums have been around for a long time, but what I've noticed in my experience since COVID, more people are attentive to their care. And I feel like facilities are making it more convenient for patients as well. And with that increase of demand, it's going to need more providers. So for a lot of startup companies, especially, or any new innovative programs that a current practice is implementing inside the healthcare facilities, they need providers that's able to start fast. And it's no more long waits, long credentialing periods. It's like, do you have the experience? Are you confident to do what we say, what you need to do as far as being a provider in the scope of practice for their particular patients and XYZ? So I see that there are more locums coming on board. And it could be locums, NP, CRNAs, PAs, especially medical doctors as well. And there's some midwives as well too. So that's what the facilities are now looking for. And that's super important. So I definitely agree with the study. And I feel like now when I turn around, I hear this person is a locum and this person, before it wasn't a thing that was spoken about. So I feel like more people is learning about, how to do this really fast without having to go through the traditional way of nursing, at least as a nurse practitioner.
No, I love that. And, my wife is an RN and she kind of explored, the traveling nurse route or locums experience and seeing what that would do for her career and just having more exposure. I think you hit the nail on the head when you talked about this is a new way of thinking about kind of delivering care and having the freedom. For instance, a research from Health Affairs highlights that financial freedom among healthcare professionals improves provider satisfaction and reduces burnout rates, which we know increased, due to COVID. How do you support NPs specifically around making that leap to these 1099 contracts, right? And understand how to balance their financial goals with their personal growth goals?
Yes. So one of the things that I highlight with every NP I work with, I always ask them what's their ultimate goal. because I realized that nowadays it's not even about, you can make all the money in the world, right? But burnout is real, especially in the healthcare field. So you have to always, like I always ask them, what's their freedom goal? That's number one. And what's their ultimate goal? What's that freedom number that you would like to make so that you can live comfortably? And then what's your ultimate goal? Are you trying to build out a practice, a telemedicine practice, a med spa, a IV hydration clinic? And what are you doing to get to that goal? So breaking the mindset is really important for me. We're used to, I've been a nurse for 10 plus years. We're used to the 9 to 5. And while there's nothing wrong with that, burnout also exists. And some people that I've come across, like nurse practitioners, like, I love my role, but I feel very stagnant, or I want to serve in a different way. And it's okay to serve in a different way, but you're going to need that time to do so. So the first thing first, I let nurse practitioners know that in order for you to be able to serve in a different way is do your own thing and structure the way you practice as a provider. That's going to mean that you might have to take off holidays, or you might have to take off the weekends, and you might have to decide how often you're going to work month to month. And so once you make that decision, that my ultimate goal is for me to open up my practice, and my ultimate goal is to make X amount of dollars a year, it is easier for you to figure out how to do that, especially the locums route. I do think what holds a lot of nurses back, nurse practitioners that I work with, is the benefits that come with a staff job. So what I try to do, especially on my social media platforms, is educate, because the more I can educate, is the more I can get you to realize that you don't necessarily need the traditional route in order to create the career or freedom goal that you want.
Mhm. I love that. Just kind of thinking outside the box. We deal with a lot of nurses in different states, and we're using more telehealth options, remote care service options. And so a lot of nurses have been in bedside for a while. And so now moving to a, different role where they're kind of dealing with patients remotely, but still kind of following the normal things, staff obligations they have as nurses. It's a challenge, right? And so when you kind of think about that, right, how are nurses kind of navigating this new normal, right? Obviously, it's not at the bedside, but now you're going to a new environment. They have their own workflows, even though you have your traditional workflows of how you deal with patient care. How you kind of guide nurses to kind of get into that space, right? To understand the flexibility and understanding how to be, not go with the flow, but really be more flexible in how they approach care, because they're in a different environment, right? And they may have a totally different way than maybe you normally practice. And how do nurse practitioners specifically get comfortable to that?
So really what it depends on is your confidence. I think that plays a big portion. And I want to be a little bit biased because I was a travel nurse. So it is a little bit easier for me to kind of adjust to different environments because I've already built that confidence over the years to be able to do that. And then having that realization that it's not the same anymore, especially since COVID, and where we're making things more convenient for patients. So then it's kind of like breaking that barrier of the traditional way of you practicing. I still think that you can keep some of the things that you normally do. There's some routines that I work remotely as an NP as well. And there's some routines that I normally do that I will not get rid of, but I will make it work for that specific role that I work in. Yeah. So in a remote setting, I'm always reviewing the consultation prior to. That's not going to change. So those things are going to be the same when it comes to that. In locum settings where I'm actually in the hospital, in the clinic, excuse me, because I'm mainly in the clinics, I go to the medical assistants and I'm like, hey, this is how I do things when the patient, especially urgent care, that's where I'm mainly in. When a patient walks through the door, you're going to get the HPI. If we know that they're coming in for urinary complaints, go ahead and get the urine ahead of time. And I feel like I could work with multiple agencies, or I work in one agency, not one clinic, but one agency, one clinical organization that have many different clinics. And the way that they operate might be a little bit different. but it's you as a provider to let them know how your workflow is. So that's one of the things that I do. I'm like, go ahead and get some of these stuff out the way, then report to me so that I can go from patient to patient to patient, especially in an urgent care setting. So I don't think that you need to completely lose what you're doing depending on the environment, more so letting them know this is kind of how I've been doing things. Can we kind of stick with it? Because these medical assistants, they deal with different providers, and some providers like you to do things ahead of time, some don't. Some providers don't even want report from you. So just knowing and understanding from the medical assistant standpoint, or the RN or the LPN that's working in that office, what it is that you want, like what it is that the NP or the MD want, but from a provider standpoint, letting them know this is how you operate. And that's where you build that relationship together. So I think that's important, especially when going through different environments, for sure.
Mhm. Yeah, it's just a culture change sometimes, and just different environments, different workflows and processes. So we work with a lot of healthcare organizations, and they have their workflows intact, right? Especially if they're doing quality measurements and understanding how to track that. And there's certain expectations on delivery of care, and how many patients you see in a day. So there's a lot of things that go into that, right? To making sure if you're coming in from the outside to kind of, with this contract, making sure you can kind of adjust to that accordingly.
And
Something
understanding the
embracing.
policies as well in
Yeah.
each location. And this happened to me most recently with a provider, not a provider, a patient that had like gastroenteritis, came in last minute. We closed at 11. They came in at 10:40. And so understanding what's the policy, what is it that you guys do here in the event that I can't get this patient to stop vomiting? What is your policy? Or asthmatic patients that come in through the door, my clinic, particularly, you only give them 2 respiratory treatments. And if their oxygen doesn't come back up, they need to go to the emergency room. Now, this might be different amongst other places, but that's one of the things that I'm strong on. I'll ask, what's the policy of your particular place? And I think that's important to review prior to any contract anyway, whether it's remotely or in-person setting.
Absolutely. When you kind of think, we work again with a lot of clinics and some large healthcare centers as well, and multi-specialty groups. They're evaluating locum tenens, right? Like, they're looking at, hey, who we need to bring on board to kind of augment. We had explosion, patient growth. We had, new service lines we want to offer. What are some of the key things I don't know how you talk to your training nurse practitioners to prepare for this journey, but what are some of the things from the folks that I deal with, what should they consider, right, when they're looking to hire on a locum tenens nurse? What kind of
That is
attributes are they looking for? What kind of, backgrounds are they looking for to kind of help in their journey to kind of help augment their team?
That is a good question. I think that when they are looking at key factors, they should really look into the flexibility of the provider as well as the experience that the providers have. So some things I don't really think you need too much experience on. For example, I did a assignment at a primary care clinic, but I didn't see primary care patients. So, I'll tell you exactly what I did. I literally got hired to run the COVID testing department in New York City. When COVID first started, we were the first outdoor COVID testing center. So when I got into the role, I thought I was just going to be the provider to just swab the patients, put the order in, and that's it. But they told me, no, we chose you because I had leadership skills on my resume. And I can be able to determine who do I need in place in order for this process to be seamless as possible. So yes, it was a primary care clinic, but they started this new initiative of designating a COVID testing center so it doesn't interrupt the flow that they already have with patient cares and chronic conditions. This is when we had an influx of people getting tested. So I literally had to set up the tents. I was like, I need a person to do, I need a medical assistant just to swab. I need a check-in person. I need a tent. I did not think that that was something that I was going to do, but because of the leadership role that I had in my years of practicing as even an RN, they were comfortable with me being able to do so. Anybody could do a COVID test, but not everybody can be a leader. And so when practices are looking for a specific provider for a specific task, they have to look at the overall picture. Right. So some things that might need to be considered is the fact that they were once a travel nurse, if they were, because they know that this person can adapt into different settings. Right. Years of experience is always going to be one that matters the most, because then you don't really have to train too much. But most importantly, if the person doesn't have years and years of experience, if a provider is willing to stay on for longevity, that is also important as well. You're not getting providers that are hopping around, because with locum opportunities, and I'm well connected with my recruiters, like a personal relationship with my recruiters. So I see what they have to go through on their end anytime a provider just comes in and then decides to leave. So the turnover rate is high on the locums end too, because they'll leave for whatever reason that they're trying to leave for. So making sure that the provider that you do have is that provider that's going to be there for as long as the project exists would be great, instead of having to do things over again.
Oh yeah, absolutely. I mean, just to sum it up, I mean, obviously understanding, the nurse or clinician that or provider you're bringing in background, make sure there's flexibility in that so they can adjust accordingly. But also one thing that you kind of brought up, if there's a new project that you're launching, right, like you did with the COVID testing project there in New York, understanding their background and if they have cohesive, creating, a new initiative, because you're right, they don't want to interrupt their current flow, the workflow they currently have. So bringing in locum tenens can help with those new initiatives that you kind of bring in and kind of spin up with the help of that. And so that makes perfect sense for the folks that we talk to all the time, right?
Yes.
Making sure they understand, kind of thinking through their goals, especially we're in a new year. The goals for this year, if there's a new big project they want to initiate. For example, we have a lot of practices who want to get into more telehealth, remote care as a service options. If you don't know, there are over 35 different CPT codes tied to remote care.
Mhm.
And, sometimes they just don't have the staff, right, to kind of handle that. And so having, an outside nurse or outside clinician coming in and kind of spearheading this project so you can grow in a scalable way is so important, because the local staff, practice admin, office admin manager, whatever staff members are always kind of, focused on other projects, right? And they just don't have the cycles, right, to kind of pick on other projects. And if they do, or if they try to do too many, as projects get left behind, workflows get messed up. And so, yeah, we see this all the time, where the importance of investing. And we always tell our clients, you need to invest in a person that can help spearhead this project so you can move forward. So,
Yeah.
I love that. Well, kind of thinking about, your journey into, social media, sharing your expertise, what kind of got you involved in that path, right? To kind of educate your audience, but more importantly, share your expertise to a more broader audience than normal.
Yes. So it's so funny because I have two social media platforms. My nursing platform actually came after my travel platform.
Mm.
So my experience started as a travel nurse. And with that, I was able to go to California by myself. That was my first ever experience, like traveling solo for work. And I went to, because Hawaii is closer from to California, I went to Hawaii by myself. And then from there, I went to Colombia, my first international trip by myself. And then it's been one all the way up to 30 trips. So no. But I still love to serve patients. So I had to figure out, okay, Ebony, at some point, how can you make this work for you? And I've gotten a ton of questions about, how are you able to travel so much? Do you even work? What do you do? Right. And so when I became a NP, I only had 4 months of experience before I transitioned into locum tenens. That's rare to have. Like, usually locums want you to have at least 1 year of experience. But for me, it was only 4 months, and I was willing to stay with the facility as long as I get the experience. And so they paid me as a 1099 contractor. Never knew what that was at all. I was a school nurse, and they paid me as a school RN before, and they paid me as a 1099 contractor as well. Again, never knew what that was before. So I made a lot of mistakes in my journey, and it took me quite some time to realize that you operating as a 1099 contractor is the same as operating as a small business owner. You still have to have everything in place. And so it took me a $30,000 taxes that I had to pay back in order for me to realize that in order for me to continue to redesign, I like to say recreate, redesign the life that I truly desire, I'm going to have to learn how to operate as a business owner. And so why I started, one of the questions you asked is like why I started like mentoring and teaching nurse practitioners. The reason why I started doing that is because I've seen a lot of people like myself 5 years ago that got into the role because the job sounds good and the job pays higher and the job had that freedom and that flexibility. And so those are all of the perks that we go into, and recruiters are not telling you, and some of them don't even know, to be honest. They have a high turnover rate too on the locum side as well with recruiters, and they're not telling you, or they don't even know that, hey, the minute you take on a 1099 contractor, you better have everything, all your ducks in a row. So because I didn't have my ducks in a row, it cost me a lot. And I always try to save nurses from the beginning. Hey, I see you're interested. Don't let that shiny bell of freedom and flexibility get ahead of you. You need to have these things set up. So that's how things started. And it just progressed and progressed. And I'm big on educating and big on serving. And then after that, I started talking about your locum exit plan. And that's what I really speak to with my mentees now. Okay, we got into locums. We got everything set up. What is your exit plan? And that goes back to me saying, what is your ultimate goal? And so now I see like nurse practitioners, they wanting to start their own private practice. They wanted to do telemedicine. They want to do IV hydration, med spa, all of these cool stuff. So locums gave them the freedom to do so, which was a mindset change. You can't go back because you're like, what's next? What can I do? How can I serve better? How can I own my own? So building that generational wealth is important for them. And yeah, that's how it started.
Yeah, usually pain internalized or pain you went through, and now that you kind of have the pathway, you always want to kind of give back, right? Shine that light and say, hey guys, this is the path I took. This can kind of help you along that journey and avoid the mistakes I made. And so we see that time and time again of doctors who have a true heart to serve and help folks. They start their journeys, like you said, they went through the pain first. One doctor talked about, she came from overseas. She came from another country that challenged her trying to become a doctor in the United States was such a pain. And now she teaches others to kind of navigate that journey, right? And so that path. So I think, you're hitting the nail on the head around understand the journey. And you're right. So people, looking for, freedom, flexibility, and finances. But then to your point, understanding the background of what that entails and prepare for that properly. And then also looking at the final end stage, right? What the goals are that you will have for this business that you're building out. So once it's established, it can grow a lot higher, just like a tree, right? It has to grow those roots deep in the ground for years, even decades, right? Before it can finally sprout up. And so I love that you're building that deep foundation for clinicians and providers who are looking toward, going that path. Well, Nurse Ebony, this has been highly instrumental in understanding of how this process works, especially for some of my clients and just general people listen to our podcast. Where can they find you? Where are you located at on your 2 social media platforms I think you had mentioned, but we'd love to learn more and what other things you have coming.
Yeah. So you can find me on Instagram. I'm gonna go to YouTube. I'm on there, but I haven't been so active on there. But that's the goal for 2025. But you can find me on Instagram at ebthenp. That's where I talk about all things related to 1099 contracting. To be honest with you, it applies to anybody that's trying to do 1099 contracting, whether you're doing 1099 telehealth, 1099 direct contracting, or locums as a 1099 provider. The information still applies regardless of which route you take. So you'll find me on Ed the MP. For my travel journeys, you'll find me on front page _Eb. And projects coming up. I'm hosting my annual Paychecks to Profit Healthcare Summit. And this is specifically for 1099 contractors, no matter what route you're trying to take. And even 1099 nurses come to it. But pretty much showing you how to leverage your paychecks that you earn as a 1099 contractor to profit so that you can start your own and build generational wealth. So yeah, that'll happen this August. And it'll be our second annual one. The first one was amazing. It turned out very amazing. I had to live stream it. It was so many people in the room. So hopefully we just get bigger and better. But yes, that's what I have as far as projects coming up.
Awesome. Well, everyone, if you want to learn more, please visit her on our social media sites. Again, thank you, Nurse Ebony, for your time. Everyone, hopefully this information is insightful, help you build and prepare your medical practice or your organization for this new normal of healthcare this year. Thank you. Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.